Hi, can you hear me? Hi, can you hear me? I hope. Yes, you are here. Two people maybe. Maybe we will wait a little bit. Okay, so we can start. Hi, my name is Maria Katzerova. I'm from Czech Republic, from Brno. I work in Children's University Hospital, but now in this time I'm on a summer camp with hemophiliac children, so it's maybe some symbolic time for me to talk to you from the summer camp with hemophiliac children. So this is why I am not in some nice ambulance, same as David and Sebastian, because I'm in the room next to our dining room. Maybe you can hear sometimes some children from there, so sorry for that, but it's time for our summer camp. So I am very happy that I can talk to you. I would like to continue, I hope, in good way, as David and as Sebastian. They talked to you with problematic about knee and ankle, and I would like to continue the sessions with cooperation EAHAD, EHC and EAHAD with the elbow. So maybe I would like to start in short with the anatomy of the elbow. I'm again sorry because I'm on the summer camp. I don't have here any model, nice model of the elbow as David and Sebastian had. So I only talk about the elbow, but I think the most important thing is the exercise, but not the bones. So I try to explain to you. The elbow is contains from three bones. Is the humerus, radius, and ulna. The three bones are connected by three joints: humero-ulnaris, ulnoradialis, and humero-radialis, of course, and they are together in one common capsula. The capsula is powered by ligamentum on the lateral side, and the very important ligamentum in elbow is the ligamentum annulare, which is around the caput of the radius. It's the movement of from the forearm like this. So this is about the ligaments, and of course, what is important for us is the muscles. The movement in elbow is for, of course, flexion, it's extension. So we have the flexors, it's biceps, brachioradialis and brachialis. We have extensors, it's triceps, triceps, and musculus anconeus. And then we have the pronators, two muscles for that, and the supinator, which is the biceps help to supinator, internal or external rotation from the forearm. This is about the anatomy, and I think it's maybe enough. The elbow is a very important joint because of the foot and for the self-service for us. So we need to have enough range of motion in the elbow because of whole life, all day things, and how I said, the self-service. So this is important to take care about the joint. So I would like to show you something like you take care about them, about elbow, how you can exercise for the range of motion, for the strengthening. The Sebastian on the last session talked about the bleeding, about consequences after bleeding, so I think it's not important to talk about it more, and I will continue to concretely exercise. So I would like to start with the soft tissue techniques because as I talk, we have the ligaments and muscles at about around the elbow, and of course on the muscles and the whole body there are the fascia. It's the very important maybe organ or system in our body, and we haven't to we don't have to forget for that. So in the physio, it's maybe the first start with the treatment is during the fascia, and you can do it at home, of course, too. I would like to show you maybe how. If you lie down with your hands on to the part of the elbow, for example here, but you don't have to only lie down, you have to a little bit push to touch the fascia, not only lie down or push, and then you turn around your forearm and you are on the stop. You cannot do more turn. So you stay in this position and you wait for the release phenomenon. So this is the situation when you can feel under your treating hands that the move is bigger. So I don't know, at about 30 seconds, you can feel that your treating hands go more over. And if you do it in a lot of positions, a lot of places around the elbow, you can feel in the end of this treat, you can feel the very good feeling from that, relaxing. It is first thing, and the second thing is that you can you will do the space for the microvessels with lymph and with blood. So, for example, when you have the swelling after bleeding and you make space for these microvessels, sorry, the blood and the rest of the blood can go and lymph can go into the stomach, so the swelling go away. So it's very comfortable for the acute phase or of bleeding, for example. But you can do this type of treatment, the fascia treatment, during the subchronic phase and during the chronic phase and during the chronic pain, because it's very painful or not painful, sorry. It's very comfortable for you during whole phase. So this is why I talk about it a little bit long, but I would like to you remember that the fascia and the soft technique tissues is very important before the exercise. Okay, it was the preparing, and now when we have relaxing fascia, we can go to the range of motion, because there's bigger possibility to have bigger range of motion after the relaxing of fascia. Sorry. Okay, so I will start with the range of motion to deflection. Very good position for me that the exercise, most of the exercise that I will show you will be in sitting by the table. It's very fine for you. So we will start with deflection. For me, it's better to have some books, for example, and I can lie down my elbow on the books, because now I can see on the good position. I can see with my arms and straight back. Then I can lie down my elbow. Okay, and for the bigger range of motion, I will use the post-isometric relaxation. It means that I use the isometric activating of the muscles for their stretching. Okay, for the flexion, I will start with the maximum of your flexion. Okay, I stop. I cannot do more. Then I lie down my treating hand, my second hand. I try to go maybe more to deflection. Okay, stop. Now I start. I start with the pushing by my treated hand to my treating hand. So my right hand push to my left hand. and left hand do the resistance. So I cannot do any move. I only push, 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 20-25 seconds. Then after the 25 second activating on the triceps, now I can inhale, and with exhale I relax with my hands, and my treating hand try to do bigger flexion. If it's not possible, never mind, you can stay on the same position for 3 or 5 repeating. So now I again push to my treating hand by your treated hand, and push, push, push at about 25 seconds again. Again, big inhale, and with exhale I relax and I try to do bigger range of motion, or only I'm waiting for the relaxing of the part of the body which was activated by isometric activity. I will do it maybe 3, 4, 5 times again, and then I expecting bigger flexion. Okay, then I can very slowly go to the maximum extension. For example, here is my maximum 3. I'm in not very good room for that. Okay, again I lie down my treating hand here and I push up to the flexion, activating the flexors, and then after the 30-25 seconds I push, push, push. It's a little bit long time, 25 seconds, then I inhale, and with exhale I relax my treating hand, treated hand, and treating hand try to do bigger or larger extension. And again I will repeat it, push, 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 up, up, up. I'm activating the flexors, so I go to the flexion, and then after 25 seconds again inhale, and with exhale I relax and I try to go a little bit down. Okay, and again repeating in about 3, 4, 5 times, and then I'm expecting relaxing of the flexors and then bigger extension. Okay, it was post-isometric relaxation for the range of motion, and now I will show you something for strengthening of the muscles. I can show you maybe the first time, if you have at home, for example, overball or something like that. You can, again, it's good to use something for your elbow. Okay, then I lie down with my with the overball here. I do flexion, what I can do, and I only push to the bigger flexion and relax. And activating flexors and nothing. Activating and nothing. This is for the flexors with the overball. If you don't have anything like this, you can use, of course, your second hand again, and we can do only the isometric activating of the muscles, or and you stay on the same position, only isometric and nothing, or you can do to the move. If you don't have any pain in your elbow, you can do maybe it's better to have some move. So I can go to the flexion, and then I continue directly to the extension, change the position of my hand and go to the extension, and then I go to the flexion, and I can strengthen my muscles by side 1 and second side again, and I can use the muscles how I need. So if I do the big resistance, it's for bigger strengthening, or I can do it only without any resistance, and you do any move, so the muscles has to work, so it's useful too, without any resistance. So it was flexion and extension. Of course, you can have some dumbbell, or if you don't have any dumbbell like me here, so you can use, for example, bottle with water, and you can use again in a sit. You can do flexion and extension, flexion and extension, or you can do it in the position when you come stand. So when I stand, and I can do like this or like this. It's up to you which position you choose, or you can change it for the maybe more interesting. And of course, you can do it was maybe more for the biceps. And if you want to strengthening of the extensors of the triceps, it's better to go back if it's possible for you with your arm, and you can only go back to the extension and you strengthen your triceps. It's useful for the bigger extension in movement. Okay, it was strengthening, but this all this exercise, what I show you to this time, it was only analytic type of movement. It was in one way. But we, as a human, we move in a 3D movement, of course. So I would like to now show you maybe the 3D exercise. And again, maybe I use the books. I lie down with my elbow again, and we can use the 3D move. So you will start with this position, maximum flexion of the elbow, flexion in the wrist, flexion in the fingers, and do the things with your fingers. Okay, and you try to go very nearby your arm with your fingers, and you start with the movement like this. You start all the time. You start with the rotation. So you start with the rotation to the small finger, and you open your hand, do the extension of the fingers, directly extension of the wrist, and extension of the elbow. And you go as much as possible for you, and then you go back. So you start with the rotation to the thumb, you go the flexion with the fingers, flexion of the wrist, and flexion of the elbow. You do the small hands and try to go nearby your arm. And again, you continue very fine and slowly to the small finger and go here, and then go here. You can do it without any resistance, or you can do it with your resistance with your second hand again. So you start, when you start, go here, this way. You have to do the push resistance here. So you start, you go here, and the resistance is near the fifth finger. And when you go back, your second hand is in the palm, and you go back again. This is very useful because it's 3D movement, and it's important for us to show and only to the hand that it's good movement for that in 3D. So it was with the movement. Or if you have pain in your elbow and it isn't possible for you to do movement again and again because it's painful, you can do it. Only without movement, of course. Again, so this is maybe the best to touch your hand like this and start with this position. And you for the stabilization of the elbow is very good. And you will do the same movement, but your left hand stopped your right hand in the situation. Okay, so I will try to do this, like in the whole movement, but I stop it by left hand, and I do only here, here, here. The left hand has to be stronger than the right hand in my situation, and I do this, and I hope that you can see on the video the whole muscles are work. I change the position here, here, so they are working. One side, second side, and if you change it, the muscles has to cooperate it. So it's very good for the using in normal life to muscles can cooperate between the opposite sides. Okay, so it was the 3D movement, and I would like to maybe go back to the other type of movement. It's pronation and supination, so internal and external rotation. I will show you. It's absolutely easy. You go here and here, here and here, without any resistance. Of course, you can go, or you can go with the resistance. So you touch your hand here, and you resistance, and then you resistance here. Okay, again and again. If it's not painful, you can do it. If it's painful, you will not do it, of course. Yeah? If you do it only without any resistance, I'll do it very, very easy. But you can exercise in your mind, and you can be concentrating for the activating your muscles. So you maybe try to find that you have to make a muscle. Okay, so you can do it in air, and you can think that the muscles has to work. Okay, have to work. Okay, so it was, sorry for the noise, and then it was elbow, forearm, wrist, fingers. But I don't have to forget for the arm, because arm is the key joint of the whole limb. And when we have in good position to the arm, it is centrating, so the functionality of the whole limb is much more better than if you are in the central position. Okay, so we will try to work on the centration of your arm now. It's very easy. It's again when you can sit, so it's maybe comfortable for you. You can sit by the table. Again, it's good to have a good height of your table. If it's not, you can do something for your forearm, under your forearm. But now I am in okay, so I cannot use anything. So your hands are on the table. This exercise is better when you use the bilateral, so I can use both hands. Okay, so I start with the lie down with my hands. In my hands, it's like something like wall. If you have this position, okay, I will have this. But I have to be careful to do not be in this position that the meat go out. My meat from my forearm has to be in this position. Okay, whole forearm is on the table, and my arm has to be centrating. And then if it's good, I can push down to the table. And if I am in centration position, it's very relaxing for the overuse muscles. It means biceps, for example, or neck muscles. So if you push down in good position of your arms, you can feel it that muscles of the stomach and of the back and from the arm are working, but the neck muscles are relaxing. Okay, how can you know it? It's absolutely easy. When you are in this position and you are in the decentrating position, your neck muscles are very strong. If you touch them, they are very hard, and you can see this muscle. If it's very good centrating, so you are in this position, there is nothing to touch. It's very soft and very fine. So now I'm sure that the arm is in good position, and then I can push down, and I can feel the muscles around the scapula, around the arm, and neck is very, very fine. This is very good for the relaxing of the neck muscles, for example. Okay, it was about arm because it's so very important. But I can go back to the whole limb and whole and elbow, of course. So for forearm, for a strengthening of forearm, we can use the isometric again, which is better because of no movement, no pain in your elbow. So very easy. You lie down with your forearm, and you only do the isometric activating of the muscles in the forearm, but of course in arm too, and relax. And you do again the activating on this part of body and relax, and again. So this is very easy. You can do it during you are watching TV or something, I don't know, and you are going by bus or something like that, because you can be very in relaxation position, and you can only do the muscles and relax, do the muscle and relax. So this is very good for whole limb, for example, or you can do exercise with more movement. You can go to this position, and then you open your hands in and again you can feel, maybe you can see in the video, I don't know, then the muscles are working very good. And again, this is the muscles from forearm. Elbow is without any move, so no pain in elbow, and forearm muscles, which are over the elbow too, are working, so this is for stabilization of elbow, very important too. Okay. The other exercise, if you have at home overball, or all of the, it can be football or a volleyball, so everything you can use. So, sorry, now you have to stand for the exercise, and you have on the table the ball, and this is very important. I don't have a good space for that. No, it's okay. Again, be in a very good position. Centration, arms, not in something like that. You try to open your wrist, your chest, okay, and you have elbow in maximum extension, and then you go a little bit 3 degree to deflection, and then you push to the overball in whole body and relax, and again you push to the overball, and again. And again, if you have good position of your whole body, you can feel the stomach muscles, back muscles around the scapula and everywhere. So again, you can do push, or if you want to, you can use your weight of your body, and again you go that. Again, you can push to the overball and relax, and I can feel the muscles from the whole limb. And of course, when I use the moving of the overball, it's something like sensomotoric type of exercise is very important too. Okay, very well. So this is the overball, and the last exercise what I would like to show you, it's very all of you know it. It's push-ups, so it's very easy. Of course, I don't want to do this type of exercise in normal way on the floor, but you can use the push-ups. Again, if you sit, you can have the table, but you have to be sure that the table is by the wall, because if you push to the table can move, so be careful for some accident. So you can do, you lie down your hands on the corner of the table, and you can use like this, hop and hop. If you go it from the side, go down and push up, go down and push up, and it's up to you how resistance will be. It's up to you how you sit. If you down, if the table is far away, so you have to go more down and more up. If not, it's up to you absolutely. Of course, you can use it when you stand. Again, I would like you can stand if it's possible. And this exercise, you can do it by the wall, okay? And again, you go down and up. And again, it's up to you. If you are here, it's very easy. It's go far away from the wall. It's more restful for you, and you have to more work with the muscles. If you have push-ups like this, you more use your musculus pectoralis. And if you use the push-ups like this, that your elbow are very, very close to your body and up, it's more for activating triceps. So this is better for us, because we need to activating the triceps, because it's what we want, because biceps are overused from our sitting position during work, during whole day, when we eat. All the time we are in this position, and biceps are overused, and then the triceps are not so used. So if we want to change the position of the arm and elbow, we need to strengthen the triceps. So this is why it's better to move push-up with this position, with the elbows very, very close by your body, not here. So, I'm very happy that I'm on the time, because I wasn't sure that it will be fine. I'm very happy that I can talk to you, but it's very strange to talk only to the laptop. So I hope that it will be useful for you, this video, and I hope that we will see face to face in a very short time. Be safe, be healthy, and enjoy the rest of the day. Bye bye.